Did you know that you will spend more than 20 years of your life sleeping? 20 years, that's roughly 1/3 of your entire existence, and most people never stop to ask themselves a simple but incredibly important question. Am I sleeping correctly? And I'm not just talking about how many hours you sleep. I'm talking about the position of your body. You know, what you eat and drink before bed, what you do in the first minutes after waking up, and the habits that are silently destroying the quality of your rest every single night. My name is Dr. Andrew Senemes, and today I'm going to walk you through everything you need to know to completely transform the way you sleep. We're going to talk about the best and worst sleeping positions, the foods and drinks that are ruining your nights, natural supplements like melatonin and glycine, and I'm also going to address those medications your doctor might have already prescribed to help you sleep. So stay with me until the end, because the bonus track at the end of this video might be the most important part of all. Let's start with something that surprises me every single day in my medical practice. And most people have no idea what the correct sleeping position actually is. They just fall into bed, however feels natural in the moment, completely unaware that their posture during those 7 or 8 hours is either healing or damaging their body. So let's break down every major sleeping position, starting with the one I consider the absolute worst. Now, sleeping on your stomach, or what we call the prone position, is one of the most harmful things you can do to your body night after night. When you lie face down, your head is forced to twist to one side for hours at a time, and this misaligns your spine completely. The natural curves that your spine is supposed to maintain are flattened and distorted. If you've ever woken up with a stiff neck, a sore lower back, or that tight, painful sensation between your shoulder blades, and you sleep on your stomach, there's a very good chance that position is the culprit. Now, many younger people sleep on their stomachs and feel fine today, but I want to warn you, the damage accumulates slowly, and by the time you feel the full consequences, years of wear will already have taken their toll on your vertebrae, your discs, and your muscles. And here's something else nobody talks about. If you care about how you age, if you care about wrinkles and expression lines on your face, sleeping on your stomach is making things worse. Every single night your face is pressed against the pillow, creating small folds in your skin. When this happens routinely, those folds become permanent. Over time, your face can actually look older than it is, not because of genetics or sun damage, but simply because of the way you sleep. So if nothing else convinces you to change this position, let vanity do the job. Sleeping on your stomach is the worst position, full stop. Now let's talk about sleeping on your back, which is one of the most recommended positions in medicine, and for good reason. When you lie face up on a good mattress with an appropriate pillow, your spine can achieve near perfect alignment. Your cervical spine, which is your neck, sits in a natural position. Your lumbar spine, which is your lower back, can be further supported by placing a thin pillow under your knees, which takes pressure off the lumbar region and allows the muscles there to fully relax. Many physiotherapists and kinesiologists actually recommend this technique, specifically for patients with chronic lower back pain. However, sleeping on your back is not for everyone, and I want to be very clear about this. If you snore, sleeping on your back can make the problem significantly worse, and here's why. When you fall asleep on your back, the muscles in the back of your throat relax and fall backward due to gravity, partially blocking the airway. Air moving through this narrowed passage creates turbulence, and that turbulence is what produces the snoring sound. For many people this is merely annoying, but for others, especially those who are overweight or obese, this is the entry point into a serious and potentially life-threatening condition called obstructive sleep apnea syndrome. So in patients with sleep apnea, they don't just snore, they actually stop breathing for several seconds at a time throughout the night. During those pauses, carbon dioxide accumulates in the blood, and the respiratory center in the brain is forced to send an emergency signal to restart breathing. The patient gasps, breathes again, and the cycle repeats dozens, or even hundreds of times per night. Each one of these episodes releases a surge of adrenaline. That adrenaline spikes blood pressure. And when this happens night after night, you end up with a form of hypertension that is extremely difficult to treat, what we call refractory hypertension, because its root cause is never being addressed. Sleep apnea is one of the most underdiagnosed enemies of cardiovascular health, and sleeping on your back can be directly fueling it. And pregnant women should also avoid sleeping on their back, especially in the later trimesters. The weight of the growing uterus can compress a large vein called the inferior vena cava, which carries blood from the lower half of the body back to the heart. When this vein is compressed, blood return to the heart is reduced, which can lower blood pressure and reduce blood flow to both the mother and the baby. That's why during pregnancy, sleeping on the left side is not just recommended. In many cases, it's essential. Now let's talk about sleeping on the right side. This is actually a very good position for the spine, especially when combined with a pillow placed between the knees. And that pillow is more important than most people realize. One without it, the top leg tends to rotate the pelvis forward, pulling the lumbar spine out of neutral alignment. With the pillow, the hips stay stacked, the pelvis stays level, and the lumbar spine can rest in its natural curve. And this is the position I personally slept in for years, and for back health alone, it is excellent. But there is one significant drawback to sleeping on the right side, and it affects a surprisingly large number of people. Gastroesophageal reflux. Reflux occurs when the lower esophageal sphincter, the muscular valve that separates the stomach from the esophagus, doesn't close properly. When you're lying down, gravity is no longer helping keep stomach acid where it belongs. And when you sleep on your right side, the esophagus, which sits more on the right side of your body, ends up positioned lower than the stomach contents. And this makes it much easier for acidic fluid to flow upward, burning the lining of the esophagus, irritating the larynx, and causing symptoms that many people never connect to reflux at all. A persistent need to clear your throat in the morning, a sensation of having a constant cold, gum sensitivity, and that unmistakable burning feeling that greets you as soon as you wake up. I know this from personal experience. I used to sleep on my right side, and I noticed I was constantly clearing my throat in the mornings. When I switched to the left side, it stopped. That seemingly small change made a real difference in my daily life, and it might do the same for you. Which brings us to what is, in my professional opinion and personal experience, the best sleeping position for the majority of people, the left side. Sleeping on your left side has an impressive list of benefits that go far beyond just comfort. Let's go through them one by one. First, reflux. When you sleep on your left side, the stomach is positioned in a way that its contents naturally pull toward the stomach wall and away from the esophageal opening. This makes it significantly harder for acid to flow upward. Studies have consistently shown that left side sleeping reduces both the frequency and severity of acid reflux episodes during the night. If you suffer from heartburn, this single change could transform your mornings. Second, digestion and bowel function. The large intestine follows a specific path in the body, and sleeping on the left side appears to support the natural direction of movement through the digestive tract. Some gastroenterologists suggest that left side sleeping may help facilitate stomach emptying and improve bowel regularity, though more research is ongoing in this area. Third, snoring and airway. When you sleep on either side, left or right, gravity pulls the soft tissues of the throat to the side rather than straight back. This means the airway is less likely to be obstructed, reducing snoring and lessening the severity of sleep apnea episodes. If you or your partner snores, simply changing sleep position can make an immediate noticeable difference. Fourth, circulation. The inferior vena cava, that important vein I mentioned earlier, runs along the right side of and the spine. And just sleeping on the left side removes any pressure from this vein, allowing blood to flow freely back to the heart. And this is why left side sleeping is specifically recommended during pregnancy, but the circulatory benefits extend to anyone who experiences swelling in the legs, poor circulation, or even facial puffiness in the mornings. So how do you choose the right position? I always tell my patients to think about three things in this order. Number one, your spine. Whatever position you choose, your spine should be in a neutral, aligned position. No excessive twisting of the neck, no collapsing of the lumbar curve, no strain. So using a pillow between the knees when sleeping on your side, or under your knees when sleeping on your backs, is a simple tool that makes a significant difference. Number two, your health conditions. Reflux, avoid the right side. Snoring or sleep apnea, avoid your back. Pregnancy, left side is non-negotiable. Back pain, avoid your stomach, absolutely, each. Condition has a position that helps and a position that hurts. Learn which one applies to you. Number three, and this is the one people underestimate, comfort. Because it doesn't matter how scientifically optimal a position is if you lie there wide awake all night unable to fall asleep. The best sleeping position is the one where you are comfortable, or you fall asleep, you stay asleep, and you wake up feeling rested. Use the first two criteria to guide your decision, and then find the most comfortable expression of that position for your body. Now let's move to what I call the enemies of rest, because even if you sleep in the perfect position with the perfect pillow on the perfect mattress, you can still destroy the quality of your sleep with the wrong habits during the day and in the hours before bed. And let's start with water. You've heard me say many times, drink water when you wake up, hydrate throughout the day. But drinking large amounts of water in the 2 hours before bed is going to force you to wake up multiple times to urinate. I have patients who come to me convinced they have diabetes or kidney disease because they are waking up 3 or 4 times a night to use the bathroom. And when I ask what time they stop drinking fluids, the answer tells the whole story. Hydrate well during the day and taper off about 2 hours before you go to sleep. Coffee, I love coffee. I drink it every day. It has real evidence-based benefits. It's anti-inflammatory, it's an antioxidant, it sharpens mental performance, improves mood, and enhances reflexes. But it is also a powerful stimulant, and how long it stays active in your system depends heavily on your genetics. The average person metabolizes caffeine in about 4 hours, but slow metabolizers, and I am one of them, can take up to 12 hours. And if you go to bed at 10 p.m. and had coffee at 4 p.m. And you happen to be a slow metabolizer, caffeine is still circulating through your system when your head hits the pillow. My general recommendation is to avoid coffee after midday. If you know you metabolize it quickly, you might be fine pushing that to 3 or 4 p.m. But if you're lying in bed with a racing mind and you had coffee in the afternoon, that is very likely the reason. Alcohol. This is perhaps the most misunderstood sleep disruptor of all, because alcohol genuinely does make you feel like you're sleeping better. You fall asleep faster. You feel relaxed, and you may even stay asleep through the first half of the night. But what's actually happening in your brain is the opposite of restorative sleep. Alcohol suppresses the deeper stages of sleep, particularly REM sleep, which is where true mental and physical restoration occurs. You may log 8 hours in bed, but the quality of that sleep is so degraded that you wake up feeling exhausted, foggy, and physically sore. If you use alcohol regularly as a sleep aid, you're accumulating a sleep debt that no amount of lying in bed can repay. Chronic fatigue, muscle pain, mood instability, and cognitive difficulty are all downstream consequences of this habit. Now I want to talk about something that ties all of this together. Your circadian rhythm. Your body operates on a roughly 24-hour biological clock, and the master regulator of this clock is a hormone called melatonin. Melatonin is produced by the brain in response to darkness, and it's suppressed by light, particularly blue light and sunlight. This is not a minor detail. It is the fundamental mechanism that tells your body when to be awake and when to sleep. Here's what most people get wrong. They think melatonin management only matters at night, but your circadian rhythm actually starts being set in the morning. So the very first thing you should do when you wake up is expose your eyes to natural light. Open the curtains, step outside, let the sunlight hit your face and eyes. And this sends a powerful signal to the brain that the day has begun, which simultaneously triggers the suppression of melatonin and starts the 14 to 16 hour countdown until your brain will release melatonin again at night. Then, as bedtime approaches, do the opposite. Dim the lights in your home. Put down the screens. Keep your bedroom as dark as possible. So this darkness signals to the brain that it's time to release melatonin, and your sleep will come more naturally and more deeply. Exercise follows a similar logic. Physical activity is one of the most powerful tools we have for improving sleep quality. When you exercise, your muscles release substances that promote relaxation and recovery, and your body temperature rises and then falls in a pattern that supports deeper sleep. But timing matters enormously. Exercising in the morning, at midday, or in the early afternoon is ideal. Exercising within 2 to 3 hours of bedtime, no matter how fit you are, raises your core body temperature and keeps your nervous system in a heightened state of arousal that directly interferes with sleep onset and sleep quality. Many of my patients who complain about lying awake for an hour before finally drifting off have evening workout habits. Moving that workout earlier in the day often resolves the problem within days. I also want to briefly address something that has become a popular topic, mouth taping. You may have seen those strips that people place over their mouths before sleep to encourage nasal breathing. The reasoning behind them is sound. Nasal breathing has real advantages over mouth breathing. Your nasal passages filter the air, warm it to body temperature, and create a specific airflow pattern that reduces snoring. People who breathe through their mouths during sleep tend to snore more, sleep more lightly, and are more prone to dry mouth, gum problems, and nighttime congestion. Some small studies have found that encouraging nasal breathing through mouth taping can reduce snoring in certain patients. However, I want to be clear with my recommendations here. Never use the wide horizontal tapes that cover the entire mouth. If anything, only use the smaller vertical strips. And more importantly, if you have any condition that affects nasal breathing, a deviated septum, nasal polyps, chronic congestion, anything that makes it difficult to breathe through your nose, do not use mouth tape. It will not solve your problem, and it may make your breathing worse. Always consult your doctor before trying this. Now for the bonus track. Natural supplements for sleep. First, melatonin. Yes, it works, but how you take it matters. I recommend quick release melatonin, taken about 30 to 45 minutes before bed at a dose of less than 5 milligrams. Higher doses are not more effective and may actually disrupt the natural rhythm you're trying to support. Melatonin is safe, has very few side effects at appropriate doses, and is particularly useful if your circadian rhythm has been disrupted by travel, shift work, or irregular schedules. Second, glycine, and this is an amino acid that has shown real promise as a sleep supplement in recent research. A dose of about 2 to 3 grams, taken 60 to 90 minutes before bed, can help not only with falling asleep, but with the depth of sleep itself. Glycine works partly by lowering core body temperature, which is one of the natural signals your body uses to initiate deep sleep. It has an excellent safety profile and is well tolerated by most people. Finally, I know many of you have been prescribed or are considering medications like clonazepam or other benzodiazepines for sleep. I want to address this directly and honestly. These medications work. They will induce sleep, and when used appropriately under medical supervision for a specific and temporary problem, they can be genuinely helpful. But they carry a significant risk of dependence, and long-term use creates more problems than it solves. If your doctor has prescribed one of these medications, follow their guidance carefully, but never take them based on a family member's suggestion or your own initiative. They act deeply on the brain, they can be very difficult to stop, and they should always be used at the lowest effective dose for the shortest possible time. The truth is that most sleep problems are not medication problems. They are habit problems, position problems, and rhythm problems. And every single thing I've talked to you about today is something you can begin changing tonight. Start with your position. If you have reflux, try the left side tonight. If you snore, stop sleeping on your back. Add a pillow between your knees. Open your curtains first thing in the morning. Stop your coffee by noon if you're sensitive. And give your body the darkness it needs to produce the melatonin that will carry you into genuine restorative deep sleep. I'm Dr. Andrew Senemes, and I hope this information has been as useful for you as it has been important for me to share. Take care of your sleep, because your sleep is taking care of you. I'll see you in the next video.